Hello everyone, and welcome back to another terrific segment of Health Talk. Well, today we are talking about the collaborative effort between Indian River Medical Center and Duke University Health Systems. And with me today, we are so fortunate to be speaking with Dr. Harry Phillips and Mr. Jeff Susie of our very own Indian River Medical Center. Prior to starting back, we were talking about what it takes to have a collaborative effort and the benefit that that has to us in our community. So, Dr. Phillips, I know that you were right in the middle of kind of explaining your thoughts to us, and then Mr. Susie was going to finish.
Well, you know, collaboration is a term that I think we need to think about a second. Collaboration is really a way that we all improve the quality of the care we deliver.
Right.
And I think particularly working with the physicians here, we have found the physicians very open to collaboration. You know, no matter how good we are at what we do, we can always find a way to be better. And collaboration between institutions, between physicians, this is a way we raise each other's game. We all get better.
Right.
I think of collaboration like I think of a marriage. It really takes two parts, and there's a lot of give and take when I see what our medical staff contributes to the heart program and their relationship with Duke and how we go back and forth, trying to develop what is the best experience for patients and the best outcome for patients.
Absolutely.
And the medical staff has been supportive of this program development. The people we've recruited embrace the idea of having an affiliation with Duke University, and I think that was part of our selection process to put together the right team of people who could make the best of a collaborative effort.
Right, and what's so nice about it too is that it really gives our program a lot of credibility by having Duke University with us, but then I think that, you know, our outcomes, definitely we stand alone and speak for ourselves. So, and also, so Dr. Phillips, if you'll I know we kind of touched on some of the outcomes that we have experienced. If you can kind of talk about that a little bit more, as well as, you know, the physicians and what we have happening here at Indian River Medical Center.
Sure. So, you know, we're all very proud of our cardiac surgical program. And the cardiac surgical program has had great surgeons, great anesthesiologists,
yes,
a great team in the OR to support them, lovely OR, state-of-the-art equipment. And the results, I think, speak for themselves. The STS scores have been tremendous. The surgical program's not resting on its laurels. A minimally invasive valve program is underway now that's going to offer new services. But I don't want to be so focused on the surgical program that we forget that this really is a comprehensive program of cardiovascular care.
Absolutely. And let me just interject by telling you, I have interviewed several of the radiologists as well. And you know, it is, you talked about the team effort. It is amazing. This is a team effort because it encompasses everybody when you're talking about taking care of a heart patient. So.
Well, and you know, oftentimes the patient's care begins in the ED, where physicians in the emergency room and their staff have to quickly react to a problem.
Right.
They have to diagnose it and treat it according to evidence-based guidelines. Quickly, those patients are transported to the cath lab if they're having an acute myocardial infarction or heart attack. And one of the metrics that we've referred to is this door-to-balloon time.
Yes.
That means the time from when the patient arrives to the point we get the blood vessel open is critically important in saving heart muscle. And your cath lab team has done an outstanding job with this. Their metrics are comparable to anywhere in the country. They beat the average times very consistently.
That's amazing. I mean, beat the average times.
It is. I mean, when you think how sick these patients are,
right,
and how well greased the system has to be to get them treated quickly and efficiently, again, with perfect technique, it's challenging.
Yes.
But again, collaboratively, I think this program can be very proud of the results we've achieved.
And Kim, when we talk about teamwork, I like to think in Vero Beach, teamwork goes even outside the institution. When you look at the community support that we've had,
absolutely.
Dr. Phillips mentioned having the latest in technology and facilities and equipment. That wouldn't be possible without the teamwork we've had with our philanthropic support. And
absolutely.
It's just a very generous community that's really allowed us to do things that are pretty unique and rare in a community this size.
Definitely rare in a community this size. I mean, I feel like we have so much to be thankful for, and I think that as I say, everything that we are doing here really speaks for itself. And I know that having this affiliation with Duke University is so wonderful for us. And let's talk a little bit about the poster child, what we were referring to before.
Well, I think we've covered, again, the benefits of a great surgical program, the benefits of a great interventional cardiology
Yes.
program. But I wouldn't want to overlook the fact that after these patients have had surgery or have had a treatment in the cath lab, they need great care in the hospital.
That's right.
And your CCU, your CVICU, your step-down units, your rehab, all of them are award-winning. Your team of physicians and nurses have done an amazing job caring for patients.
Right. And so where else would you want to go?
I think the right care right here is the answer.
Absolutely. Well, do either one of you have anything else you would like to make sure that we...
Well, I think it was Jeff's goal from the beginning that we could offer the level of care that one would receive at an academic medical center right here in Indian River. And I think we've accomplished that goal. Patients get personalized care here, a nice smooth transition back to home or their local caregivers. And again, we've got a lot to be proud of with this heart program.
I agree. And I think the fact that patients, should something happen to you and should you have a heart attack, the fact that you can stay here in your own hometown and in your house, or if you happen to be from up north but you are down here, you don't have time to go anywhere else. So you want to make sure that if you have to stay home, that you definitely are getting the best care you possibly could get. And I just think that it was the greatest idea ever to make sure that we, as you and I have talked before about not reinventing the wheel and making sure that we do have the right care right here. And I feel like we've really demonstrated that. And I think that the residents of Indian River County are so blessed and fortunate. So I hope that you have enjoyed this terrific segment of Health Talk, and thank you, gentlemen, for joining me.
You're welcome.
Thank you.